Kai, you've been trying so hard to keep yourself happy. Please let us help you. Join the online counseling for a change. Kyla is a 20-year-old woman who's been struggling anxiety and depression. She's been working with an online counseling and have built a therapist and patient's relationship.
Good day, Miss Kyla. Thank you for joining me today. Can you tell me more the reason that you decided to try this online counseling?
I don't know. I just thought of trying it out.
I see. Would you be willing to tell me more about this? What's going on?
I don't know. I don't think that there's a problem with me. I'm fine. But at the same time, I feel like I'm not.
I understand. It's okay not to know how you feel and how to say it in words, but I think it's important for us to explore and to know what's going on in order to help you. Would it be okay if we talk sometime to talk about it?
Okay, I'll give it a shot.
After a few sessions, they have to establish a good relationship.
So last sessions, we talked about some of the things that you had been bothering you. Are you comfortable to talk to me more about that?
Yeah, no, it's just that I've been stressed with ACADS lately. Plus, my friends have been kind of distant with me. And I'm not sure why.
I can see that those thoughts have been bothering you. When you think about your friends being distant, what kinds of feelings come up for you?
I don't know. I'm not sure. I'm not even sure about what I'm feeling. I just know that something doesn't feel right.
All right, I see. Sounds like you're having trouble acknowledging your own feelings. Is that something that's come up for you before?
I don't know. I just know that I get stressed out and stuff, but I never really thought about it in terms of my own feelings.
Sometimes they can be can be easier to focus on external event or other people's feeling rather than our own. But it's important to explore how you're feeling so we can work through some of these issues. Would you be willing to try that?
Yeah, okay, I can give it a try.
Clients can freely talk about self, although as an object. Clients talk about feelings and emotions, about past and future tense, avoid present feelings.
So, Kyla, we've talked about some anxiety and what you've been experiencing. Can you tell me a little more about that?
Yeah, it's just I feel like I'm not good enough. Like I'm always failing short. I'm afraid that people will see me as a failure and a disappointment.
I can see that these thoughts have been bothering you. It sounds like you're starting to talk more freely about yourself and your experiences. Can you tell me a little more about what you mean by seeing as a failure and as a disappointment?
I don't know. It's like I'm not doing better. Like I'm not meeting any of my own expectations. And then I worry about what other people might think of me. Like they'll see me as a failure and as a disappointment.
I see. It sounds like you're recognizing your own feelings and emotions more, which is a good sign, but it's more important to acknowledge and accept those feelings in the present moment. Can you tell me more about what you're feeling right now?
Well, I guess I'm feeling kind of nervous. Like I don't know what's going to happen in the future.
That's a common feeling, Sky. It's okay to feel nervous or shaking with our future. It's natural thing to feel. Let's explore that feelings a little more. What does it feel like in your body?
My palms are sweating and my heart is racing a little bit.
Thank you for sharing that with me. Okay, that's a good step towards recognizing and accepting your feeling, your present feelings. Let's work together to find some coping strategies that can help you manage those feelings when they arise.
Okay.
Kyla is in stage 4 therapeutic change process according to Carl Rogers because she is beginning to talk about deep feelings but not ones that he is presently feeling. She talks about feeling angry and frustrated in the past or in general terms, but has a hard time acknowledging and accepting those emotions in the present moment.
About your anxiety and depression feelings with your academics. Can you tell me more about that?
Yeah. It's just that my family is always on my business, and I feel like I can't do anything right. I get so angry sometimes.
It sounds like those feelings are really intense for you. Can you tell me more about what it's like to experiencing that anger and the frustrations?
I don't know. It's like I'm going to explode.
I can understand why you would want to try to control those feelings, but it's also important to acknowledge and accept them. Can you tell me more about what it's like to feel angry and frustrated at the same present moment?
Well, I guess it feels like a tightness in my chest, and my heart is racing. But I don't like feeling that way, so I try to push that away.
I can understand why it might be difficult to express those feelings in the present moment. It's a big step to acknowledge and accept those emotions, especially if you've been denying or distorting them in the past. Let's work together and find some strategies that can help you more uncomfortable expressing your feelings in the present.
In this scenario, the client is stage 5 of therapeutic change process according to Carl Rogers because she is able to express feelings in the present although she may not yet accurately symbolize those feelings. She is starting to rely on her internal doubts of evaluation and make new discoveries about herself. By acknowledging and accepting her feelings, she can move towards stage 6 where she can fully and accurately symbolize her emotions and work towards making meaningful change.
Glad to still reach out for help, Miss Kyla.
I've been having a really hard time with my coursework. I get really anxious and it's hard for me to concentrate. And then I get even more depressed when I don't do well on my quizzes and exams.
It sounds like it's really impacting your well-being. How have been you coping with these feelings?
I've been trying to avoid studying altogether, which just makes my anxiety worse. And then I feel guilty for not doing any better.
Understandable that you will feel that way. Have you ever tried to identify and express your feeling in the present moment?
No, not really. I just try to push them away.
That's a common coping mechanism, but it may not helpful in the long run. In order to move forward, we need to be able to accurately symbolize and express our feelings. Can you tell me more how you're feeling right now?
Um, I guess I still feel nervous and unsure about talking to you, but I also feel hopeful that maybe I can start feeling better.
That's great. It's important to acknowledge and accept these feelings, both the positive and the negative ones.
In this scenario, the client progressed to stage 6 of Carl Rogers' therapeutic change process. They are beginning to freely allow into awareness those experiences that they had previously denied or distorted. And they are relying on their internal locus of evaluations for their feelings and making fresh discoveries about themselves. The counselor is providing a supportive and non-judgment environment for the client to explore their thoughts and feelings and work towards self-actualizations.
I don't know what to do. I feel like I'm drowning in anxiety and depression. I have so much academic work to do, but I can't seem to focus or motivate myself.
I hear that you're feeling overwhelmed and stuck. Can you tell me more about what you're experiencing in this moment?
I feel like I'm failing. I'm not good enough. I'm never going to be able to catch up or succeed.
It sounds like there's a more self-doubt and self-criticism going on. Can you tell me more about where those feelings or thoughts come from?
I guess I've always put a lot of pressure on myself to excel academically, but lately it just feels like too much. I'm struggling to balance my coursework and my personal life. I feel like I'm letting everybody down.
It's understandable that you would feel overwhelmed with all those responsibilities. It's important to take care of yourself and well-being as well. How can we work together to prioritize your needs and set realistic goals for yourself?
I don't know. I'm scared to slow down or take a break. What if I fall behind even more?
It's okay to take a step back and reassess your priorities. It's important to acknowledge and honor your feelings and needs. Let's explore some coping strategies and self-care techniques that can help you manage your anxiety and depression. And remember, progress is not linear. It's okay to have setbacks or difficulties along the way.
Okay, that makes sense. Thank you for your support and guidance. I feel like I'm starting to make progress and understand myself better.
Carl Rogers' seventh and final stage of therapeutic change is characterized by clients becoming fully functioning persons of tomorrow. This means that they have reached a state of self-actualizations in which they are able to fully accept and integrate all aspects of themselves, including their strengths and weaknesses.
Uh, I've been seeing a therapist for a few months now and I feel like I've made some progress. I used to feel anxious and depressed all the time, especially when it came to my academics. But lately, I've been feeling more confident and capable. I'm even starting to enjoy my classes again.
That's great to hear. It sounds like you experienced some positive changes.
Yeah, I feel like I'm growing as a person. I used to be so hard on myself and would always beat myself up if I didn't do well in school. But now I'm learning to be kinder to myself and to focus on my strengths.
That's wonderful. It sounds like we're moving into seven stages of therapeutic changes process. Were you able to generalize your experiences in therapy to your life outside of therapy?
Yes, I definitely feel like I'm becoming a more fully functioning person. I still have some work to do, but I'm excited about the progress I've made so far.
It's great to hear that you're feeling excited about your progress. Remember, growth is a process and it's okay to have ups and downs along the way. The important thing is that you're continuing to move forward and make changes in your life.
Boom!
Like that.
Yay!
Isend na kayo sa
Oh wait,
Google Drive.